Relieve thumb pain now for base of thumb arthritis pain. The most common joint in the body to get osteoarthritic change, believe it or not, is not the knee, but the base of the thumb. Because humans have opposable thumbs and we use our thumbs repetitiously throughout life, any impairment, imbalance, weakness, tightness, faulty movement pattern can occur about the wrist and hand. These would be the common movement diagnoses that leads to the degenerative change of the base of the first thumb. This is known as first CMC, carpometacarpal, base of thumb, where this little bone called the trapezium articulates on the base of the first metacarpal. If this bone starts to slide back excessively, or this little saddle bone has altered mechanics, we will get excessive wear and tear in this joint. How do we get short-term pain relief? Well, we want to hold on to the trapezium and distract the base of the first from the trapezium wrist bone. So how do I do that on myself? It's not as good as when a clinician does it because they can stabilize the bone above and pull the base of your thumb or first metacarpal away. However, I can push down on this knuckle bone, sometimes creating a crack or a pop, which we know as cavitation. This helps reset or reposition the bone appropriately on the carpal bone. If that bothers you, I can grab the base of the first, stabilize the wrist to my abdomen, bunch up the skin to really grip onto the bone. You want to be as close to the joint as you can. Distract this bone and hold for 5 to 10 breaths or 30 seconds to a minute, 2 to 3 times. Let's say you reach for something and jam your thumb or try to open up a jar with a really tight lid and this hurts you immediately. You can get immediate pain relief by distracting this joint. Doing this on a daily basis can also help you have long-term base of thumb pain relief. I can progress the mobilization to more dynamic motions where I rock the base of the first metacarpal down and up. And depending on the movement diagnosis, you might need one direction more than the other, which is why you need to see a human movement diagnostician to know which is best for you. If you're not sure, distraction improves motion in all planes, as well as will often relieve pain. Next, I'm going to go for long-term thumb health. This requires a daily thumb and hand wrist program. We want to start to move our thumbs through a full range of motion. This is called opposition, and this is called palmar abduction. Do 3 sets of 10 to 20 repetitions. Next, we want to do retropulsion, which is kind of extension or a back motion of the thumb, 10 to 20 times. Next, we do 10 clockwise circles and 10 counterclockwise circles. You'll find that one side will be much harder than the other. The side that's harder is actually a right brain, left brain, right hand, left hand discrimination issue in how we engage with our physical environment. So we sometimes need to do some extra on the more difficult side. These would be wonderful warm-ups prior to use of your thumbs. Next is body mechanics and ergonomics. Do I grip on one side of my hand and crank the base of the thumb, or which would cause more stress and strain into this joint, or do I do a lumbrical grip using the core of my hand the little deep muscles with the big muscles instead of just the big muscles. And now I'm using much bigger muscles like my chest and my shoulder. I'm also pushing through this lid before I turn. Now we're using much larger muscles to decrease the torque in the much smaller muscles and tendons that cross the thumb. Long term almost always requires some sort of strength. We often lose abductor pollicis longus strength. And in some people, you'll see this knuckle will start to flex. So notice that as I strengthen the extensors in the abductors, I am not hyperflexing this knuckle. We want 3 sets of 10 to 15 reps, 2 or 3 times a week. We also want to balance strength of the extensor and abductors with grip strength. We now know that grip strength is tied to longevity. However, this grip strength is very specific. Notice I'm not putting excessive stress and strain through the joints, and instead I'm purposefully using the core muscles of the thumb, known as the thenar eminence. These are the muscles that are affected when you get conditions like carpal tunnel syndrome. These are best done more timed, so I'm going to recommend 3 sets of 1 to 2 minutes, 2 to 3 times a week as a starting dose. You can progress by adding stiffer balls and or using further resistance. I'm doing 2 main movements. One's across. That's called opposition. And then one, I'm kind of flexing the base of the thumb, but not over flexing the first IP or the first knuckle of the thumb. I'm keeping neutral joints to strengthen without putting undue stress through the joints. This is Dr. J with our Relieve Base of Thumb Pain Now at the Human Movement Institute, where we have improvement through movement.